Hello and welcome to another episode of Nutrition Essentials, a side project of our popular Health Essentials podcast. I'm John Horton, your host, here again with registered dietitian Julia Zumpano.
Hi, John. I'm so excited to discuss food allergies today, a common thing that affects young children and families.
Oh, Julia, it is a topic that really hits close to home for me. I have a son with food allergies, and I can tell you, as he was growing up, it was difficult. We had to kind of navigate our way and kind of figure things out on our own. But thankfully, there is a lot more information out there today, and even some ways that people can hopefully avoid having food allergies develop in children.
And that's why we brought in allergist Dr. Jaclyn Bjelac. She is the Associate Director of the Cleveland Clinic Food Allergy Center of Excellence.
Well, we've had Dr. Bjelac on before, and I can tell you she has so much useful information and really just presents it in a way that makes you feel a little more calm and comfortable as you're dealing with some of these. And she even has some tips that could hopefully help your child maybe avoid food allergies. So give it a listen. Welcome to the podcast, Dr. Bjelac. It is so nice to see you here.
Thank you so much for having me. I'm looking forward to being back.
We've been looking forward to it because I know we had you on for a few Health Essentials podcasts, and it's nice to get you on for a Nutrition Essentials one, just to really kind of dig into this whole topic of food allergies and kind of everything that's going on with it.
Oh, it's so important. So thrilled to be here.
Very excited to have you here. Thanks for joining us today.
Thank you.
So before we start, one thing that you say, which I always love, is that you hope that you're eventually out of a job.
Yeah, I think I usually say fun employed, but yes. I think, in medicine, we're always working to try and prevent disease as much as we can. And I've dedicated my career to food allergy, and it would be a great joy for me to not have to focus on that anymore, for it not to be something that patients and families manage.
Well, it's definitely something I think that would be best for everyone. But unfortunately, we are not there yet, which is why we need your wisdom here today. So let's just to kind of get started. Let's just kind of talk a little bit about food allergies because they're so prevalent. And I know I was looking up numbers, and I think it said 1 in 10 adults has a food allergy, and 1 in 13 kids. And those numbers have just been going up, it seems like every year.
Yeah. And, depending on whose papers you read, they're increasing at a pretty exponential fashion too, right? And I'm glad that you mentioned adults because, food allergy we used to think was a pediatrics only disease. But unfortunately, many of our adult patients develop new allergies in adulthood or carry their allergy from childhood into their adult years. It's so prevalent. It's so impactful, not just for our individual patients and their family units from the choices that they make every day at the grocery store, what they have for dinner, eating out at restaurants, but food is so social. So anyone who's making particular diet choices, whether it be for safety, like food allergy, cultural or personal preferences, or intolerances, which can cause terrible symptoms if you have a slip up, right? That impacts all facets of our lives because, food is everywhere.
A lot of times I think people don't truly understand what a food allergy is. It's like you hear it, you know, you shouldn't eat it, but walk us through a little bit, kind of what happens to your body if you do have a food allergy.
Yeah, that's a really great question. And I think comes down to making sure we're using the words food allergy in an appropriate context. This is different than a food intolerance. And there's many medical reasons or social or personal or religious reasons to make food choices. But when we're talking about food allergy, we're talking about an immune response to a food. And for reasons that we're still trying to understand, people's immune systems have identified this food as something that's potentially dangerous. So on exposure to the food, which almost always has to be you eat it or you touch it and kind of have a mucosal exposure, mouth, nose, or eyes, your immune system says, oh my gosh, we've had this exposure. and the allergy antibody has already attached to allergy cells, then it forces them to break open when it's exposed to that particular food. And those allergy cells release chemicals like histamine, you hear about, we take antihistamines for allergies, but in just this amount that can cause potentially serious whole body allergic reactions to something that's not supposed to be dangerous. It's really just the immune system making a mistake.
Yeah, we had a doctor on a podcast the other day. We were talking, and she kind of described it as you have guards in your body, kind of guarding the castle, and they look at something that shouldn't be a threat, and they perceive it that way, and they go a little crazy, and the result is, I mean, your body can really have some damage, some bad things happen.
I think that's a great analogy. They're guards or soldiers, however you want to call them. They're supposed to be there, and they have really important jobs, recognizing germs and other things that don't belong in our body. But it's just inappropriate identification of food proteins, which are supposed to be very safe, as not safe.
I think it's also common that people do misunderstand the difference between an allergy and intolerance. We screen for allergies for every patient I see. I check their allergies just to be sure that they don't have any food-related ones. And oftentimes when I dig deeper, I realize majority of the allergies listed are in true intolerances. So I think that the big differentiating factor here is that the allergy affects the immune system and the intolerance affects the GI system. So you may get more of a GI effect, some nausea, maybe diarrhea, constipation, and it may even affect your skin, but most likely it's not going to be anything, very compounding that's going to continue to get worse or, create a life-threatening outcome.
Julia, I think that's a really great way to put it. Intolerances are bothersome. I have people close to me in my life who, if they have an accident and they have wheat, they're miserable for hours. Mm-hmm. Not life-threatening, but certainly impactful. And differentiating between the two, I think, is important in understanding risk. The risk if you have an accident with an allergy is potentially anaphylaxis. The risk if you have an accident with most intolerances is certainly very unpleasant symptoms, but not something that requires a prescription for an epinephrine auto-injector or another epinephrine delivery device. I think that it's important to reassure families and patients that while their condition is serious, and we absolutely would recommend not eating foods that make you feel sick, doesn't need epinephrine for potentially life-threatening allergic reactions.
Dr. Bjelac, I know we just threw out the term anaphylaxis.
Yeah.
Tell us a little bit, describe what exactly anaphylaxis is, and two, how common it is, because that's kind of the boogeyman of allergies that gets tossed out there a lot, and everyone's afraid of it. And sometimes I think it's not as prevalent as what we think, but I know it's always a threat.
So I think this is a really important question, John, and actually one that doesn't have a definitive answer. There are a couple of different definitions of anaphylaxis out there. So when I talk to my families and patients about food allergy, we talk about food reactions as like a spectrum. And you can have very mild reactions. We don't have mild food allergy, but we can have mild food reactions. And that can be even just a few hives where a food didn't touch, maybe an itchy, drippy nose, some itchy, watery eyes. These are all things that we can see. And then there's the spectrum, and any organ system in your body can be involved in anaphylaxis, which I think is really important. So thinking about, we've been talking about the gut. You can have anything from mild nausea to vomiting, multiple episodes over and over. When you're thinking about skin, you can have a few hives, or you can have head to toe covered in hives and even swelling, which is, sort of on the basic level, just hives underneath the skin. And then we can have things that impact the respiratory system or our breathing. Of course, John, as you mentioned, that's something that brings a lot of fear around reactions to families. But you can have coughing or actually wheezing, especially in our patients with asthma. So, and then, You can also have impacts on your cardiovascular system. So, anaphylaxis, when severe, can cause a drop in your blood pressure that can keep the blood from flowing as well as it's supposed to important parts of your body, like your brain. So, people will actually say that they feel dizzy or lightheaded. And kids may become actually very agitated when they're having severe reactions. So, while reactions can be severe, reactions that cause death and fatal anaphylaxis are thankfully very rare,
Very
but
thankfully.
but they do happen, right? And I think anytime there's a situation where you or someone that you love is at risk for that, it does create an understandable amount of fear. But we want to reassure families that these are usually preventable. Um, and that's why we carry our epinephrine autoinjectors. So no matter where you are in kind of that spectrum of anaphylaxis, so those whole body allergic reactions, giving epinephrine early, epi first, epi fast, has been shown to reduce the risk of progressing to more severe symptoms and is the fastest, safest way for kids to feel better. So absolutely, we want to equip families to recognize symptoms of allergic reactions and then to carry their epinephrine autoinjectors.
Epi first, epi fast is a great phrase. I've
Yeah.
not heard that before, and I can't believe I haven't.
Oh, well, good. Well, tell everyone to tell your friends.
I definitely
That's a great
will.
one.
Yeah, and you had mentioned with all those symptoms and kind of that spectrum. I know with food allergies, the one thing that's kind of there too is you don't know what your reaction is necessarily going to be. So you could, I know, react to you're allergic to a certain food, let's say peanuts, because that's one everyone's familiar with, and have like a rash or that sort of reaction, time and time again, and then one day it goes really haywire.
So most reactions will mimic prior in severity, but we always want to be prepared for reactions that could potentially be worse. And hopefully, they might even be less severe. And a lot of different things can play a part in the severity of a reaction. How much of the allergen are you exposed to? Did you have a bite or did you eat a whole bag of cookies, right? So that's going to be different. And what are you doing around the time of the ingestion? Are you exercising? Anything that increases your heart rate is something that we call an augmentation factor. Or are you just sitting on the couch watching a movie? So many things can play a role, some of which are in our control and many are not, right? Like you can't control when you're going to have an accident and what's going on, which is why we're prepared for more significant symptoms to happen, even if they've never happened before.
So, as we've been talking about allergies, I know there are 9 foods that are kind of the big 9 of food allergies, and just if you can kind of walk us through kind of those foods that are most likely to be triggers.
Yeah, that's a great one. So in kids, the most common are cow's milk and hen's egg. And then peanut, of course, always gets a lot of publicity, rightfully so. And then the tree nuts, which kind of get batched together, but we think about in particular cashew, pistachio, walnut, pecan, and less commonly almond, hazelnut, and other nuts like macadamia and Brazil nut. And then we have sesame, which is really an emerging allergen, was added to the required allergen labels in the US a few years ago. So something definitely to be aware of for families. And then we have wheat, soy, and finfish and shellfish. And I don't think I forgot any. Was I?
No, I had them written down
Oh,
because whenever you're going through a list, you always forget that one. So I've been checking them off as we've been going.
You can certainly be allergic to any food, but far and away, that group of 9 are the most common triggers. So when someone comes to me and they say, my little one was enjoying peanut butter and bananas and XYZ happened, I'm feeling far and away the most likely culprit here is going to be peanut as opposed to the banana.
And the most common, the big ones there, I know shellfish is the most common, which I was a little surprised because I don't feel like you hear as much about that one. But that seemed like that's the top of the list.
Yeah. So for our adult patients in particular, and that's one that tends to persist. So if you develop a shellfish allergy, that will tend to persist into adulthood when you're a child, whereas milk and egg are the most common in kids, but those tend to be outgrown.
So Dr. Bjelac, when people first find out that they have food allergies, like what kind of happens? Because it's not something that seems you don't just go and take a random test at the store or something like that. How do you find out that you are allergic to a food?
So when we're talking about true food allergy, reactions are not subtle. A patient will ingest a food and then have symptoms such that when they bring their child to me or a patient comes to see one of our allergy colleagues on the adult side, they're going to say, I had this after I ate that. Really, we're just there to sort of confirm what they suspected all along, right? We do have some testing that can help confirm that your immune system is paying attention to a food in an allergic way. But there is no allergy test that can say, yes, you're allergic or no, you're not. The only perfect allergy test is what happens when you eat a food. So what'll happen, history trumps everything. So what'll happen is someone comes in and they've had an exposure and symptoms. We do confirmatory testing and then kind of walk families through managing that on a day-to-day basis. What does that look like with reading labels and advocating? What does trick or treat look like if there's someone who is celebrating that upcoming holiday? And how do we recognize symptoms of allergic reactions? And how do we intervene with medicines to keep their kids safe? And then, thinking about opportunities for treatments and things, that's usually a later conversation. The first visit is what should you expect and how can we support you? Because it is, really an life-altering diagnosis.
Now, when do most people find out that they have a food allergy? Is this something that's kind of during childhood, or are there people who are, they're in their 40s and all of a sudden they can't eat crab?
Mm-hmm. Most people with food allergy develop their food allergy in childhood. And it is very true that you can develop new food allergies in adulthood. But the vast majority of individuals will find out before grade school or in the early grade school years, especially with increased exposures in childhood now that we've realized that eating allergenic foods earlier, there might have been a lot of kids out there who weren't eating peanuts until they were quite a bit older than now. So we're finding these allergies earlier and earlier.
I have a question on that. What if someone does develop an allergy later in adulthood, or even, I've heard of a lot of my patients say, well, I developed in college or right after high school, or, maybe even transitions of their lives after I got married. And so do you think any of that plays a role, or do you have any insight on that?
Yeah, I think that is a really great question. And if I knew, I'd probably have a Nobel. But
Yep.
I think a lot of us in the community do feel like loss of immune tolerance to a food that you used to be able to eat, albeit infrequently. Usually it's foods like shellfish or, right, I used to be able to eat shrimp all the time and now I can't, is maybe perhaps post-infectious, like a post-viral sort of immune switch happens and then you lose that tolerance. We are still learning about the impact of stress and how that impacts our immune system, possible loss of tolerance. I would be remiss in telling you I knew why, but it's an area of interest because if we could figure it out, if we could learn more about why we have food allergy, we would be working towards better prevention and cures.
That's very interesting.
Mm-hmm.
Now, Dr. Bjelac, you had mentioned you brought up food introductions, and that's
Mm-hmm.
where I know we want to spend a lot of our time talking today because there's been so much new research and kind of knowledge gained as to how maybe we can prevent food allergies going forward. So talk to us a little bit about I guess the importance of I guess giving kids some of these highly the top nine, those big nine foods, like exposing them to those foods early and how that might help prevent food allergies from developing.
Yeah, I think this is such an important topic. And when I was growing up, I don't want to date myself too much, but it was very much the recommendation from the major medical organizations that kids not be exposed to peanut, for example, until they were about 3. I think some families followed that guidance, some didn't, but that was what we were telling people. And then the story of how things have flipped in what's actually a very short amount of time starts with some really brilliant researchers who noticed that in Israel, very few children there have peanut allergy. And they said, why in the US do so many kids have food allergy? And in the UK as well. They're actually UK researchers. So I don't want to like make it sound like the US is responsible for this.
Spread it around, right? There's a lot of shared knowledge.
Why in other Western countries are there such high rates of peanut allergy, but in Israel there aren't? And the answer comes from a puff snack that is sort of the Cheerios, if you will, of Israel. It's one of the first finger foods that families will offer to kids in their very young infant toddler years. And it's covered in a peanut dust. So these children were eating peanut much sooner than kids in other Western countries and had lower rates of peanut allergy. So the researcher said, is this as simple as it might seem? And they did a beautiful study that showed that in kids who are at high risk of developing peanut allergy, so they had severe eczema or already had another food allergy like egg, if you give them peanut early in infancy, you can reduce their risk of developing peanut allergy by over 70%.
Wow.
Wow.
I mean, that's a number that gets your attention.
Yeah, right? Everyone's excited. I'll take those odds. So that study is called Learning Early About Peanut, or the LEAP study. And it has completely changed how we practice allergy across the world. There have been follow-up studies with other foods for some select ones, but LEAP was clearly the first and the most powerful effect. And what we know about early introduction is that it can reduce the risk of food allergy. It can't prevent it for everyone. And it doesn't seem to have any adverse impacts, which is really important. Like when we're feeding little babies, we want to make sure we're not doing something that could potentially cause harm. So it does not seem to impact rates of breastfeeding, which is so important for many of our mothers, right? They want to keep up with breastfeeding. And it does not ever seem to cause severe enough reactions that we need to be worried about fatality. There has never been an infant death from early peanut introduction that has been documented yet.
That is such an important point. 'Cause I know when we were talking ahead of this and you said that, and I'm like, never? And you said never.
Never.
That's a big statement. And it seems like one of those things, if you're a parent, to kind of realize that there's some safety in doing that, and maybe having a little bit of that peanut exposure early and not be worried about something bad happening.
And we take all food reactions seriously. And there are certainly kids who do react to those first doses of peanut. So we want to encourage patients and their families to talk to your pediatrician about your child's risk and if there's anything we should be doing specially before you introduce these foods. But one of my partners says the line that we shouldn't be afraid to introduce the food. We should be afraid not to.
That's a great point.
I love that.
I used to work in pediatrics. I started off in pediatrics, and I do remember the days where, we avoided so many things and created a lot of fear around that. And then when as time went on, I had my own children, and I think the shift happened when I was having children. So I remember, my son, we restricted, and, I think I introduced peanut at a year. I definitely didn't.
You were ahead of the game.
And then, that study came out, and then my daughter was born, and I pretty much gave her everything right off the rip. She was so tiny. She needed so much extra food. I was like, peanut butter is the way to go. Let's get you fattened up. So, and it's nice to, not create that fear. And it's very fearful. It really is. If you do, have struggle with an allergy or have this fear that your child may develop one, but, just kind of knowing that you can have some ease around it. There's good data to support that giving it early is now safe. It's the way to go.
Julia, I love that because let's normalize that parenting can be an anxiety-provoking experience. And I
Yes.
A
think
little
in the
bit.
age of like parenting and the
Just mild.
time of like digital and social media, we have access to all this information. And I think it's great for certain things, but then also like all the bad things that can happen. And to your point, I do think that we over medicalized how we feed kids, and it's ingrained this fear in us about feeding our kids. And I will share with you too, and then anyone who listens to this, just, in this safe space, that I was afraid to feed my kids their food allergens too. And I'm a pediatric food allergist. Like, let's acknowledge that, like, this happens.
It's real.
So I would go in the other room and I would have my husband do it because I felt like I was going to overinterpret anything. Like, did you just sneeze? Like, what just happened? Yeah. And whatever families need to feel empowered to feed their kids, they should feel like they can bring that up to their pediatrician. Do they need to meet with an allergist? We don't want to delay food introductions, but some of my favorite conversations are meeting with families of young kids and saying, here's a plan and here's what we're going to do. So hopefully we can touch on some of that today, so all the listeners can skip the visit with me and still have those tools.
And that is what I was going to ask you next, because we say do these introductions, but how does one go about doing that? Because when do you give your toddler lobster or eggs or any of these other things that we're talking about, and what's kind of a safe amount to give them?
Yeah, and it's overwhelming. Let's acknowledge the overwhelm. I think there are a lot of wonderful pediatricians who are up to date, who might have print resources for families. There's some great social media accounts that I would love to kind of name drop. I think Solid Starts is a good one. They have an allergist on the team who emphasizes kind of what to look for when you're introducing those allergenic foods. And of course, I think, as I mentioned, sitting down with your pediatrician before starting solids is important. Talking about any health concerns your child has, any increased risk for food allergy that they might have. Have you been managing really severe eczema? And it's really important to note that there's some pretty good guidelines, but at the end of the day, most kids don't have food allergy. So we want to introduce these foods in a way that feels right for your family. And no matter what the outcome is, you did everything right. You did the best you could with the information you had at the time. So when families come to see me, we talk about the major allergens. So cow's milk is one. And, Julia, I would love if you want to chime in too, but one of the things that we recommend is actually whole milk yogurt. I also am a fan of cottage cheese. Those are great kind of baby foods because whether you're going to do more of the baby-led weaning or just, purees into more solids, whatever your journey looks like, I want to be supportive of that. And whole milk yogurt and cottage cheese. People say don't drink milk before a year of age, and that is correct, but we can absolutely have cow's milk before a year of age, things made with cow's milk. So shredded cheese is another fabulous baby food. They can pick it up off their tray. One important tip when you're feeding, especially allergenic foods for the first few times, if baby-led weaning is your journey, hear me say I'm supportive of that, but I would really encourage trying to directly introduce the food into the mouth the first few times. And the reason for that is that many kids with sensitive skin, especially kids with eczema, will get actually like a rash around their mouth when it comes into contact with certain foods. Those can look anything from just some mild redness to actual hives. And I think we could all appreciate why that might be anxiety provoking to families. But most of the time, contact hives are not cause for alarm. And we want to keep feeding the food. So I don't want your first food allergen introduction. Baby picks up a spoonful of peanut butter and licks it and then smears it all over their face and maybe on their super cute onesie or on their hands. And then they break out in hives everywhere it touched. I don't want that for you or for your family. So we want to directly feed into the mouth the first few times until you know your baby tolerates that food, where a few contact hives won't be alarming to you, if that makes sense.
Yeah, that's great advice. I love starting with dairy. I'm
Yeah,
sorry. I love starting with yogurt. I think that's a
yeah.
perfect segue into some dairy, the whole milk yogurt. And then, as you continue to introduce it, pairing it with some fruit, I think it's a great way to begin.
Yeah. So once you've introduced an allergen, we say early and often. So we've gotten milk in, we want to keep it in the diet 2 to 3 times a week, is sort of what we recommend based on generally accepted knowledge. Your baby could have yogurt every day if you wish, but at a minimum, let's keep reminding the immune system that it's safe by continuing to keep it in the diet. So the next on our list is eggs, so hen's eggs. Some kids don't love the texture of eggs. Like, how do you like your eggs? Scrambled, sunny side up, hard boiled. So one of my favorite ways to get eggs into the Bjelac kids is French toast. When you have that lightly heated egg wash on a piece of wheat bread, that you can get egg exposure with that, and then also wheat as well. And the first time baby eats an allergen, I'd probably have it be your only one. But once you've tolerated each one at least once, feel free to combine. And that's how I think we will all survive this food introduction journey together, is by combining foods, because it's hard to keep track.
Would that count as the dairy as well? The dairy piece, since you're like putting the milk and the egg wash together?
It sure could. Amount wise, it's probably not quite enough
Minimal. Yeah,
protein because most of us just do like a splash,
sure.
but some is better than none. So
Yeah,
I'm here for it, right?
sure.
So I think that's great. And wheat, I think anybody who's managing non-celiac gluten intolerance, celiac, or wheat allergy knows wheat is hard to avoid. Wheat is everywhere. So once you get wheat into the diet, whether it be soft breads, noodles, wheat-based multigrain cereals, all of these are great baby food options. We just want to feed normal serving sizes for a baby, which is usually anywhere from a quarter to up to half of an adult serving at the most. And then keep that in the diet a few times a week. And for those of us who love our carbs, it's easy to keep in there, right?
Now, Dr. Bjelac, you had mentioned introducing them kind of one at a time.
Yeah.
How big of a gap should you have in between them? Like kind of do one week and see how they tolerate it, and then bring another one in just to make sure you're kind of looking at each one individually?
John, I love that you asked me this question. No more than a day, right?
Okay, one
If
day.
we are waiting a week in between our food introductions, whether they be common food allergens or other foods, we're never going to achieve the diet diversity that we know is actually really important for a lot of health implications for kids.
See, being tentative. That's what you said, because you get scared. So you're like, okay, a week should be good. So one day you can.
One and done. Move on, team. We got this. And if something happens and you've introduced multiple foods together, once the dust has settled, hear me say I'm hugging you virtually, and then find a board certified pediatric allergist and we will help you sort through which food it was.
Yeah.
So I tend to introduce lots of allergens together. The more appropriate answer to your question is at least a day apart.
Okay.
And I think we can all agree, based on emerging evidence about the importance of diet diversity, we don't want to delay food introductions, not based on any kind of good evidence, waiting days at a time, or I've heard weeks at a time to like see if they'll have a reaction. Food reactions aren't subtle. You're going to know within 2 hours if you've got a problem.
What happens when you filter that out as a physician? How do you filter out which one it could be if they introduced several?
We can use testing to help us risk stratify. And then when in doubt, we do challenges to each of the potential culprits in the office if the testing doesn't help us identify a clear trigger.
Now, I know you said early and often, and let's kind of get into what that means for these kids just nutritionally, because I imagine that there's a big benefit in getting these allergens in, and just you're getting so much out of all this food, that there are just kind of health benefits that extend beyond what we're talking about.
Yeah. So by early, we mean, right around the 6-month mark when baby's ready for food. And you should always talk to your pediatrician first. And then once you've introduced it, ideally sometime between the 4 to 6 and the 9-month marks, you want to keep it in the diet if possible 2 to 3 times a week. Because if you eat it that one time when you're 6 months, that's awesome. Regrettably, sometimes we hear about, well, we did that introduction and then a year later we had peanut again. And that was the next time we had it. And then you have a reaction. So we need to keep reminding the immune system that a food is safe. The perfect answer of how often that needs to be is actually not well understood. So we base a lot of these recommendations on that initial LEAP trial that we spoke about earlier. And they gave their kids the allergens 3 times a week in that study.
Right.
So now we've got milk in, we've got eggs in, we've got wheat too. And then getting into the food that changed all of us, peanut. So we don't want kids eating choke hazards, especially when they're little. So we don't want kids eating whole nuts, at least until the age of 3. I have some pediatrics colleagues tell me you have to be able to spell it if you want to eat it. So we want to use either thinned peanut butter. There's a lot of sugar-free varieties out there for families who want to minimize added sugars. They make peanut powders as well. I want to try and minimize brands as much as I can. And then once baby's old enough for finger foods, they make really fabulous, as first seen in Israel, but now easily available at grocery stores near you, these peanut butter puffs, which a lot of kids love for finger foods. So lots of different opportunities to introduce peanut, and you can spread it on crackers or spoon feed it or make sandwiches from it. And many kids like the taste of peanut butter, especially if they weren't initially allergic.
I always like to mix the peanut butter with like a mashed banana or even like with a little applesauce, something with low allergen risk food, but it can liquefy it a little bit.
So it's not super tacky.
Yes.
Because then you've got the kids like gagging, which is great. Gagging is protecting your airway, but also anxiety provoking. The kids are gagging all over the place. We don't want that. And then there's tree nuts, and the biggest bang for your proverbial buck is focusing on almond, cashew, because it looks very similar to pistachios. You kind of have those two together in one. Hazelnut, and then walnut, because that covers pecan. Certainly kids could be allergic to other nuts. I don't want to minimize that for any family listening who's managing a different tree nut. But in the US, those are the biggest culprits for allergens, but also for exposures. And a better allergist would tell the listeners to do those one at a time before combining them. I tend to personally lean on commercially available mixed tree nut butters that have all of them, or if they don't have all of those big 4, I will add the one that's missing. There are entire lines of products made with cashew. There's cashew cheese, cashew milk yogurts, cashew milk, and cashew butters that you could add. A less variable story for walnut, but you certainly can buy walnut butter. And then almond is one of my favorite foods to get into kids' diet, because just like cashew, there's so many products made with almond, many of which are really nutrient dense. Almond milk yogurts, almond butters, and many of those tend to be peanut free and manufactured in peanut free facilities. So simpler to introduce for families. So you can either do them one at a time and then combine them. I kind of right out of the gate do combine them at our house. And then my kids will enjoy, a heaping tablespoon or 2 of that mixed tree nut butter a couple times a week, whether it be in a smoothie or on top of a waffle. And that's how I know that when they want to enjoy pistachios out of the bag or cashews from some mixed nuts at a party, that they've had those exposures, they're not going to have an allergic reaction. And for me personally, I think it's more practical to keep in the diet in that fashion as opposed to all of them individually. But more power to people who do them individually.
And this is where it seems good to emphasize again what you brought up earlier is that it is very, very safe to do this because young kids just do not traditionally have those severe reactions to these allergens.
Yeah, it's one of my big selling points, I think, for families is the earlier we get it in, the less likely they are to have a severe reaction if they have a reaction. It's not impossible. I've certainly seen it and heard of it. But thankfully, the risk is much, much lower the younger you are. You don't have that robust immune reaction that you do when you're a teenager.
As you're doing these trials and you're doing these challenges, like what would be something that would happen where you really want to reach out to your pediatrician or an allergist to kind of get a second opinion as to what's going on there or really look a little closer?
Yeah, I think that's a really great question. And not to sound trite, but I think anything that worries you deserves, a message or a call to your pediatrician.
Trust those instincts, right?
Yeah, you know your child better than anyone else in the world. If your mom or dad's spidey sense is tingling, please trust yourself that something's not right with your child. And that goes for all things, but especially food allergy. Mm-hmm. And then, those symptoms that we were talking about on that spectrum of allergic reaction, rash where a food didn't touch, repeated sneezing, itchy, watery eyes, runny nose, any vomiting, of course, would be, an obvious sign that something's not quite right. And anything respiratory, coughing, wheezing, seek emergency medical attention and let your pediatrician know what happened. I think it's worth mentioning, I've had families ask, should I sit in the ER and feed my baby? And while I don't think that that's necessary, if that's what helps you feel empowered to feed your baby these foods, then please do it, right? Whatever we need to do to get the food in the child.
And is there something if you have a kid and maybe their sibling had a food allergy, does that raise your level of worry a little bit, or is it completely unrelated?
Well, so having a sibling with food allergy does not significantly raise your risk compared to the general population. I think it adds a layer of complexity if you have a 4-year-old in your house that's allergic to peanut. How comfortable are you bringing peanut into your home for this early introduction? That's a family choice. And I think every family has to weigh kind of risk benefit for them. And 4 might be a little old because I do think most 4-year-olds are equipped for us to say, we know that this food isn't safe for us, don't eat it. So maybe a 2-year-old would be a better example. We don't quite have that impulse control yet. Maybe something fell on the floor. You don't want your 2-year-old to pick it up. How comfortable are you with that being in your home? And I think there are many parents who've seen their children have food reactions and they just want to avoid that for their younger child. So talking with your pediatrician and your allergist about what that journey looks like for your family is really important.
What about if the parent has an allergy? Does that create more of a likelihood for the child?
Yeah, so having any kind of allergy in a parent does increase your risk to have allergies in general, but not significantly higher for food, and certainly not to a particular food. So if I had $1 for, grandma and me are all allergic to shrimp, I know little Johnny is going to be allergic. Well, he might be, but not because everybody in the family was, only because it's a common allergen and it's slightly increased for food allergy. So the actual particular food allergen is not heritable.
What I really love about this idea of doing these challenges early and really kind of getting these different foods into the diet is just that it kind of teaches kids just to eat a well-rounded diet and get a lot in. I know both of you guys have kids. My wife and I, we had 3 kids. Kids eat weird and they're so odd, and they'll go through stretches where they won't eat this or they won't eat that. And it just seems like if you build this concept that you eat and try everything, maybe you kind of set them up for better eating habits as they grow up.
I think it's important that we take away kid food and adult food. There's many families that may make a meal that is ideally served for the adults, and then they make your kids something separate that might be more kid friendly, like chicken nuggets and french fries. But I really do try to encourage parents to make one meal, which is way simpler and way more, effective use of your time, and just feed everybody the same meal and continue to encourage a variety of foods, new foods. And then, as they grow and as they develop into, adolescents and even adults, they'll be more prone to have a more varied diet and try new things too. So it's really important from, even a long-term perspective of your perception of eating and eating habits and your diversity. And we know the benefits of a diverse diet, and it plays such a great role in the gut microbiome, which, houses 80% of our immune system. 70 to 80% of our immune system is housed in our gut. So when we talk about food allergies and immune response, it's really important to really build up that gut microbiome and have that diversity as much as possible.
Yeah, Julia, making the one meal thing was always a rule with us. It's like we always told the kids, we're the worst restaurant ever. There's one option, and
Yeah.
that's it. And if you don't like it, we'll see you at the next meal. Maybe that one will hit you a little differently, but we're not getting into this game of making all this different stuff.
Right. My daughter will still play that game. She'll be like, well, I'm not eating that. I'm like, okay, that's fine. You still have to sit with us.
My kids have horror stories. Yeah, I figure it's good for you. Okay? It builds up strength.
Yeah.
Dr. Bjelac, you talk about doing these challenges and specifically when you're young. So let's say, you kind of came of age at the point where this wasn't happening and you have this food allergy and now you're in your 20s. Is this something you can jump on that train now and try to introduce some of these foods? Or once you cross a certain point, is it you just don't go there?
Well, I want to be sure that I understand your question. If you've already developed a food allergy, we don't want to be eating the food on purpose. But I certainly think that no matter what you or your family chose when you were young, the vast majority of people don't have food allergies, and we eat foods kind of intermittently as they come. Most of your immune system is sort of set in its ways before kindergarten. That doesn't mean it can't learn new things and it's not adapting and growing, but most of the benefit for allergen introduction likely happens in even very young kids, as opposed to even earlier than grade school or certainly adulthood. So if you don't have a food allergy, continue just as you were, enjoying foods as they're part of your diet and as aligns with kind of your goals and preferences. And then if you have a young child in your life who hasn't had any of these food allergens yet, it's never too late to try new foods. We always want to encourage that.
What about an adult that may have an allergy, like maybe even a young adult, and they're thinking they may want to challenge that allergy in a safe environment? Is that a possibility?
So I would absolutely recommend that they connect with a board certified allergist. One of my favorite things to do is delabel food allergy, either allergies that someone has outgrown over time or where they were labeled with a food allergy just based off testing that wasn't interpreted correctly or something like that. And then we're able to introduce the food. But once we know that you're at risk for possible anaphylaxis, that really should be done in a physician supervised setting.
How often does that result then in somebody either finding out maybe they don't have the allergy that they thought they had, or is it even possible to switch that immune system response later in life?
Every single encounter is really individualized. So it's the role of your allergist to tell you, I think based on your numbers, we have a 50-50 chance, or I think there's a better than 75% chance. And then you as the patient would decide, is that risk worth it to me to learn if I'm tolerant or still allergic? And then in that setting, regardless of the outcome of the challenge, the supervised challenge, what an important question to answer. Even if we are treating symptoms during the food challenge, then, when it's time for our patients to go home, our adult patients, they'll say, well, I'm really glad I know that I need to still avoid this food. Like, that's very powerful. It's really important. And then it's one of my favorite things about my job is being able to delabel, to have a kid who was avoiding, hazelnut their whole life. And now all of a sudden they can eat, the famous hazelnut spread, or, get more excited about what they can pick for their candy and trick or treat. It's a really, really cool experience.
So we've covered just an immense amount of ground here today and really kind of looked at food allergies from a lot of different angles. So kind of we're winding down our time here. So Dr. Bjelac, if somebody's listening here, what are the key points you want folks to take away from this talk when it comes to food allergies and I guess specifically if you have kids?
Yeah, like what's the executive summary?
Yeah.
We know that introducing common food allergens early can prevent food allergy for most people. We want to give foods early and often, and we should be more afraid of not feeding our kids than we should be to feed them. And anything that you need on your journey to feel equipped with food introductions, making sure your kids are meeting their nutritional goals, fear of possible allergic reactions, or if symptoms occur with any food introduction that are of concern to you, please connect with your pediatrician. The internet has a wealth of information, and while other people's anecdotes are true for them, that's not what's necessarily true for your child and your situation. So I think connecting with a pediatrician that you have a good relationship with is really important. And then if you or your pediatrician feel like it's important based on what happened, please connect with a board certified pediatric allergist, and we're happy to help you through that journey.
Great advice.
Definitely great advice. So I think we helped a lot of people here today.
I hope so.
Yeah, no, we did. You always have such great information. And food allergies, as you brought up, it's one of those things, especially as a parent, you get so worried about it when you have kids and you start hearing about it because you think the worst. And I think you did a lot to help alleviate that, maybe help parents take a deep breath and just feel comfortable and confident as they introduce these allergen foods to their kids.
Well, it's been a pleasure. Thanks to you both so much.
Thanks so much.
Julia, that conversation was so fabulous with Dr. Bjelac. I'm just really struck by how parents can help their kids overcome food allergies early by just introducing the foods at a young age.
Yeah, I think it's great how the recommendations have really advanced to include more early introduction. And I think Dr. Bjelac did such a great job in breaking that down, putting it in, a day-to-day perspective for a parent and how they're trying to maybe navigate that process. And, from a dietitian perspective, I love to hear that we're adding more foods to a child's repertoire versus, avoiding and taking away.
Well, I know you always encourage us to eat a well-rounded diet. And the thing that I really loved about what Dr. Bjelac said is that, if you're a parent, you should really feel comfortable doing this. You shouldn't be overly worried, and that it's really safe to do these challenges at a young age.
Yeah, and that there are so many great resources, including allergists. So it's really very comforting to know that as a parent.
Oh, it definitely is. So if you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. And until next time, eat well.